de minister. Dear colleagues, dear friends, dear collaborators and future collaborators, it's a great pleasure to open this first conference and to do this today. Today, the 12th of October, it is exactly 1 year ago. Exactly 1 year ago that we received the excellent news at the KCE that the budget had been approved to launch a new program for publicly funded trials. And last week, less than 1 year later, we had the immense pleasure to sign the first contract with the Society of Pediatric Oncology to finance Belgian contributions to an international VINCA study. And very honestly, we are proud to be there in just 1 year. Proud, but also extremely grateful. First of all, grateful to the Minister, who granted us the responsibility and the resources to set up this program. Grateful to our colleagues of MIHR, with special reference to Tom Wally and Sarah Pudicon, who, from the first day onward, were extremely generous and effective in helping us in all sorts of ways to get our program up and running in a record time. Without this jumpstart and their hands in our back, we would be nowhere near to where we are today. Thank you also to the colleagues of ZonMW in the Netherlands. It is thanks to the opportunity to step into the VINCA project that they coordinate that we will enroll our first Belgian patient probably this week, next week, or in the coming next weeks already. But of course, we are also particularly proud and grateful to the small KCE team who, under the energetic impulse of Frank Hulstad, has realized a terrific amount of preparatory work in very intense months that lie behind us. And then, of course, last but not least, there is you. Your massive attendance today is a testimony of the momentum of this moment. Thank you to all among you who shared their knowledge, experience and time in our committees, expert panels, or by sending in proposals. Thank you to the international partners, to the people from EORTC, from ECRIN. Maybe we in Belgium, we had some years of lag to catch up, but I dare say today that we are writing history. And this will be a collaborative endeavor, where we see already today that the academic centers and the other hospitals seize the opportunity with both hands to build up that network. And the challenge will be to make this commitment crystallize into an effective network, generating synergies and leveling up the competencies and efficiency of all partners in true win-win situations. And maybe there is a last challenge I want to mention here, which is the involvement of the patient. We at KCE have now this trials program, but we have another line of research, which is the patient involvement in decision-making in healthcare and in the healthcare system. And the challenge will be to find bridge and to find crossovers between these two programs, so that our clinical trials program is effectively and really responding to the true needs and unmet needs of the patients and is looking at the outcomes and the parameters that really matter to the patients. And then we will have realized something which is a win situation for the most important stakeholder in this, which is the patient and the citizen, which is all of us, eventually. So, I wish you a very fruitful conference today with a lot of exchange and probably also the onset of good collaboration internationally. But now it is my pleasure to announce our minister who will speak a few words to us.